Our final guest today is Stephanie Herron, Brunswick-Novant Medical Center's Manager of Emergency Services. Well, Stephanie, welcome back to the show. It's been a while since we've seen you.
Yes, thank you, June, for having me back.
It's great to see you. And for our viewers out there, though, who haven't met you, tell us your role at Brunswick-Novant Medical Center.
Sure. My name is Stephanie Herron, and I'm the Nurse Manager of Emergency Services at Brunswick-Novant Medical Center.
And how long have you been at that hospital, Stephanie?
I've been there for 16 years.
That is a long time.
It is.
Yeah, so you've seen it go through a lot of changes.
Yes, we have seen a lot of changes in 16 years.
Now, I'm sure that our viewers would like to hear how you got to be where you are today and how you became the manager of emergency services at Brunswick. So tell us a little bit about your education and your background.
I've been a nurse for 18 years. I started out first as an LPN and
You must have started when you were 12 years old because you look like you're...
Yes, I did. Thank you, June. So it's been a long time that I've been in nursing. I started out with my associate degree in nursing and have been in emergency department for most of my years in nursing as well as critical care. I've been at Brunswick for 16 years and for the last 6 years have been the nurse manager there, and 2 years ago received also my bachelor's degree in nursing.
Awesome. That's an awesome resume you have. Well, I think that the last time you were here with us in the studio, you were still in the old facility.
Yes.
Correct? Well, tell me what it's been like for you and your staff to move to that beautiful new facility and all the changes that you've had to go through. How is that for you?
It is wonderful. It's a beautiful facility, and we could not be happier to be there. We went from a 12-bed ED now to 22 beds in our emergency department, which is a big difference for us. We're able to see more patients throughout the day. Our rooms are also set up differently and around the nurses' station, so we can visualize all of our patients at all times. And we also now actually have closed rooms with glass doors and TVs in the rooms to help for the patients to be occupied, you know, during the wait time as they're waiting for their testing to come back. And it just makes it so much easier to care for our patients, and I feel that they're much more comfortable there at the new facility.
Oh, I'm sure they are, and I'm sure it's an easier atmosphere for your staff to work in. I mean, it just seems the flow is so good, and just by way of being so open and they can see one another, that must help immensely.
It does, very much so. It gives us easier access to our patients. It's a much easier flow to work with, and I think the patients enjoy it a little bit better rather than being so cramped together.
Yeah, well, that sounds great. Now, I understand that your department, the emergency department, has received some awards for emergency services recently. And I think one of them is from the American Heart Association. Is that correct?
Yes.
Well, tell me about that one.
Sure. We were recognized by the American Heart Association for a Lifeline Mission Award, and it's for our STEMI care. Our STEMIs are ST elevation MI, which is a heart attack. Okay. So what they identified is that when we care for our patients who have heart attacks, we provide excellent care. When a patient comes in and states they have chest pain, we're able to get an EKG done within 3 minutes, identify that there has been some heart injury or issue, and then we begin transport for them, because what they need at that point is they need a cardiac cath. And our goal is to have our patients out of our emergency department and on the road within 30 minutes.
Wow, that's pretty aggressive.
And then to be in the cath lab within 90.
Wow. And so by meeting all of those criteria, that's what qualified you for this award, is that correct?
The recognition for excellent care.
Well, that's great. And I think that really speaks to the care being provided to a patient suffering from a heart attack and being seen in your emergency department. So I want to talk a little bit about that, that experience. Now, you said that you have those goals to meet, you get them transported within a certain time. Walk me through that, what that might look like when they come in the door. What happens first?
Sure, it's very, very quick. First thing is you're going to be taken back and an EKG will be done. Once we get the EKG done, if it shows some elevation, immediately the physician's going to call up to New Hanover, usually, because that's our closest cath lab, and they're going to speak to a physician there as a consult. Once they accept, we're going to start the paperwork, and in the meantime, the nurse is going to be working with the patient, putting them on the monitor, giving some oxygen, giving some medications to help decrease the pain. And starting an IV and we're going to get some blood work right away, but really our goal is to make sure that they can get to the cath lab and get to intervention as quickly as possible. So we're going to treat pain and we're going to start transport. So it's a very quick process.
And that can make all the difference in the outcome.
That is very true, because what they say is that time is heart muscle.
Oh,
The faster you can get to intervention, and if there is a clot that's causing that pain, getting that clot removed, that's going to decrease any injury to the muscle.
That's what has to happen. Wow, that's an awesome award. But I think that you guys got another award for trauma services, I believe.
We did.
Let's talk about that one.
Sure. Our trauma award was actually from our region. We belong to the region's Southeastern Regional Advisory Committee, which is a group of 8 to 9 hospitals in our area. And we were awarded a trauma award earlier in the year for the excellent service for our trauma cases. And that's voted on a service by looking at the care we provide to our trauma patients.
Oh, wow, that's interesting. Well, these accomplishments must be well received by your staff. I'm sure they feel really awesome to have have those awards. So that's a great accomplishment for you, I think, and your staff.
It is. Thank you.
So it sounds like that you all are prepared for like any emergency that walks through the door. Am I right?
Yes, we are.
Well, let's switch gears a little bit and talk about new services. Now, I understand that you've added teleneurology and Tele Psychiatry. So can you tell me a little bit about those services and when they might be used and how that works?
Sure. It's telemedicine. It's for both groups of services, and basically what happens if we have a patient that comes in with a neurological emergency, such as a stroke.
Okay.
Once we identify that issue, then our physician will call for a consult with the specialist on call, is the group of physicians that we use. They'll talk to our physician on the phone, and they'll go through the consult and talk about the patient's care. We've hooked our CT reader to their CT machine so that they can receive the results, and that neurologist on the other side of the phone can actually look at that head CT of the patient.
Oh, I see.
Then what we have is actually a webcam. It's almost like a laptop. It's a very large laptop that's on wheels. We take it into the patient's room, and the physician will then come on over this laptop and this webcam, and he'll talk to the patient and do a full assessment of the patient.
And so the patient can talk with the physician on the other end from, what was the group called?
It's called Specialist on Call, and it's neurologists all over the United States.
Really?
Yes.
And so that's available 24/7?
24/7.
Is that
Yes,
correct?
ma'am. Yes, ma'am, it is. And once they decide on what that care and treatment's going to be for the patient, they send us recommendations that our physicians can then use to provide treatment.
And how does the patient respond when this is offered? Do they like that service?
They do. The patients and their families, I think, have been very happy with
I
that
bet
service.
yeah.
To have a specialist there, and right away, we can have that specialist to their bedside within 20 to 30 minutes.
Wow.
And have them doing a full assessment.
And then the family's probably able to participate too if necessary.
They can.
Because oftentimes I would think that if it's a stroke, maybe the patient can't talk or...
Sometimes, and that's why we also have the nurse in the room during those neurological assessments. The nurse will assist the physician, and maybe they'll help them to move limbs, or maybe they'll ask questions, or have them help to prep the patient. So the nurse is there and available as well.
Oh, that sounds like a great service. Now, has that been available very long?
Yes, it's been about 1.5 years now that we've had that service. And then recently, within the last year, we've added the Tele Psychiatry piece. And it's actually it's the same company, but of course a different group of physicians, which are psychiatrists. And those psychiatrists, same process, in the same type of treatment, will take the webcam into the patient's room, and they'll come and they'll do an evaluation of the patient.
And then they could then specify what kind of follow-up care needs to be received by the patient and things like that. Well, that's awesome. And then the patient gets to stay local, doesn't have to travel to Wilmington for that consult or whatever. It's right there in the emergency department.
And not only just in the emergency department, it can be used throughout the whole hospital.
Really?
Any nursing unit, they can use both services, neurology and psychiatry.
Wow, that's a great plus. Gee, I think that's probably one of the best things that's happened to Brunswick County.
It's been a wonderful addition for us and for our patients.
Great. Well, that's wonderful. Well, before we wrap up, is there anything else you'd like to share with our viewers about the emergency department?
We're just very grateful for our community and for the support that's been shown to us, and just really want the community to know how much we appreciate them and all that they've done for our facility and for our emergency department, and that we're there if they ever need us, and be happy to provide health care for them and for their family.
Wonderful. Well, Stephanie, it's been a pleasure to see you again. It's great to have you here always, and I look forward to hear about the next awards that you all win.
Thank you, June.
You're welcome.